It's the Roaring Twenties. Prohibition is in full swing. Jazz fills the streets. And modernity takes hold. In Canada, over a bottle of Old Par, physicians lay the groundwork for a dermatology community that will shape the future of the field for decades to come. The 1930s and 40s bring challenge and change. Despite the Great Depression, dermatologists press on. In 1935, Dr. Mary Eliza Schofield becomes Canada's first female dermatologist, paving the way for others. That same year, Canada joins the International League of Dermatological Societies, strengthening its global presence. The following years see significant developments in the field, including the naming of Sulzberger-Garb disease in 1937. During World War II, Doctors Donald Mitchell and H.A. Dixon serve as dermatological consultants to the military, cementing dermatology's importance in armed forces medicine. By 1946, Canadian dermatology stands on its own with the establishment of the Canadian Dermatological Association. The 1950s and 60s usher in scientific discovery as Canadian dermatologists lead research in psoriasis, eczema, and skin cancer. In 1952, Dr. Harold Orr becomes the first dermatologist to serve as president of the Canadian Medical Association. In 1961, Drs. Gibson Craig and Roy Forsey lead the CDA's successful push for standardized dermatology training. Breakthroughs continue to shape care. In 1963, Dr. William Pace revolutionizes acne treatment with benzoyl peroxide. Trailblazers like Drs. Lila Redmond, Paula Schopflocker, and Ricky Schachter are the first women to earn certification from the Royal College of Physicians and Surgeons of Canada. The 1970s and 80s bring in the modern age. In 1972, Canada's first English and French dermatology examination boards are established to standardize training nationwide. Groundbreaking discoveries follow. Dr. Arthur Burt identifies Burt-Hogg-Dubé syndrome in 1975, while Drs. Jean and Alistair Carruthers revolutionize cosmetic dermatology with the botulinum toxin in 1987, unlocking new treatment possibilities globally. Ricky Schachter makes history in 1978 as the first woman president of the CDA.
She would always find something else to do to try and improve the patient's condition. However desperate everybody else was, she would always have another little trick. One of the areas which I then took up as well in Ottawa was wound care, and she was very good at doing wound care, difficult wounds, at a time when there wasn't that much available for tricky wounds. She was definitely a pioneer and never would give up on a patient, would always be very determined to try and get them better.
Education evolves with initiatives like the founding of the Canadian Professors of Dermatology in 1983. Advocacy grows with programs like the Sun Protection Program in 1989, helping Canadians identify effective sunscreens.
So basically in the early 80s when I went under training, it was basically do a punch biopsy, how to do a shave, electrodesiccation and curettage of tumors, simple excisions. But in the 90s, more formal training in dermatologic surgery was developed.
The 1990s and early 2000s bring global collaboration and innovation. In 1991, Drs. Sheldon Pollack and Alistair Carruthers established the Canadian Society for Dermatologic Surgery, followed by the founding of the Canadian Society of Investigative Dermatology by Drs. Daniel Sauter, Kawachi Jimbo, and David McLean. While in 1996, the Journal of Cutaneous Medicine and Surgery launches as a peer-reviewed resource for groundbreaking research. Public health initiatives take center stage. Dr. Jason Rivers' landmark sun protection survey in 1997 shapes awareness campaigns, while Dr. Ricky Schachter receives the Order of Canada in 1998 for her pioneering work in skin cancer and psoriasis. Her legacy lives on through the renowned Toronto Dermatology Centre that bears her name. In 2009, Dr. Dana Hansen makes history again as the first Canadian in 4 decades to lead the World Medical Association, focusing on advocacy, both for patients and physicians, and on health and the environment. The 2000s also see advancements like the Vitiligo Area Scoring Index, improving care worldwide.
The Vitiligo Area Scoring Index, which was originally published in 2004, was developed here in Canada by our group, and it was intended to be a method for clinical evaluation and measurement of vitiligo. So the acronym that it goes by is VASI. So you may hear people talk about the VASI, but the VASI, V-A-S-I, represents the quantification of vitiligo.
As technology evolves into the 2010s and beyond, Canadian dermatologists embrace innovation in treatment and patient care while advocating for greater access and equity. In 2011, Canada wins the bid to host its first World Congress of Dermatology, a milestone led by Drs. Jerry Shapiro and Harvey Louis.
The 2015 World Congress of Dermatology was the 23rd iteration, or the 23rd time that the World Congress was held ever. So the first World Congress was in 1889, and that was in Paris. And then every 4 or 5 years after that, there was a World Congress. 2015 was the year that the World Congress came to Canada, and it came to Vancouver. Some of the newest treatments that we have now in 2025 were first introduced 10 years ago during the WCD in Vancouver. So Janus kinase inhibitors are very mainstream in dermatology. They're an important part of what we do in dermatology. No one had even heard of those back in 2015, but it was in 2015 that a lot of the basic research and the early clinical studies were being featured here in Vancouver.
2013 sees the launch of the Skin Health Program, providing Canadians with a way to identify products with low irritation potential and empowering them to make informed skincare choices. In 2015, Dr. Harvey Louis, having led the successful bid with Dr. Jerry Shapiro in 2011, not only sees Canada host the prestigious World Congress of Dermatology that year, but is also elected president of the International League of Dermatological Societies, ILDS, a testament to Canada's growing influence and leadership in global dermatology. In 2018, the association launches its first ever podcast series, JCMS Author Interviews, followed in 2019 by Dermalogs, a podcast specifically designed for dermatology residents. These initiatives provide new ways for knowledge sharing, mentorship, and professional growth. The COVID-19 pandemic reshapes dermatologic care in 2020 as telemedicine becomes an essential medium in providing care to patients. The CDA responds swiftly by establishing a COVID task force, hosting its first virtual conference, and expanding digital education initiatives.
I think the pandemic forced us to really evaluate how we provide and deliver care and what requires in person and what can be done well virtually. And to have comfort with teledermatology, it was there among some providers before the pandemic, but after the pandemic, everyone had to use it. Like your teenage patients all the way up to your elderly patients, even little kids were attending school on their computers. So I think that literacy of using technology really improved on the patient side and on the physician side. And what that allowed was more use of teledermatology. We really figured out some interesting use cases of how to use it in our practice and integrate it.
In recent years, advocacy has taken center stage with initiatives like the CDA's formal advocacy platform in 2024, addressing Canada's dermatologist shortage, and improving access to care, setting the stage for critical policy discussions and long-term healthcare improvements.
The CDA is a professional organization representing dermatologists across the country. And as such, it has access to provincial and local dermatological initiatives that are being undertaken to improve care. And it allows communication to occur between different provinces, different groups, different areas. The CDA is a unified voice for dermatology and dermatologists when it is trying to go forth and lobby for more resources better care, more dermatologists, new technologies, all of the things that will hopefully address some of the major obstacles and issues we're facing in dermatology.
100 years, countless breakthroughs, one enduring commitment to advancing dermatology and improving lives.
Dermatology goes far beyond the skin. It's about supporting a person's overall health and well-being, including mental and emotional health. As dermatologists, we also play a key role in public health, from promoting sun smart behavior and early detection of skin cancer to helping manage outbreaks and epidemics.
Medical care in Canada is evolving, and we need dermatologists available to care for patients in every community, big and small. Skin health should be accessible to all Canadians, no matter where they live. Remote communities need improved access to healthcare, and investments in areas like teledermatology can improve access and efficiency, especially in rural and remote communities.
I think as dermatology continues to evolve, we're going to see obviously some stresses on the system, but we're also going to see great opportunities. And we need to advocate together for a brighter future, a better future, and better access to dermatology across this country.
The past century has shaped the future of dermatology in Canada. As we move forward, the CDA remains at the forefront, guardian of the profession, supporting our members, and driving advocacy for years to come.